share on Pinterest your baby just threw up all the milk they've chugged down so far, and you're wondering if it's okay to continue feeding. How soon should you feed your baby after vomiting? It's a good question. Just about every parent has likely pondered this. Spit up is almost a rite of passage for babies and parents. Baby vomiting is also common and can happen for many reasons. Most of the causes aren't serious. The short answer, because you may have a very fussy baby on your hands and want to get back to them ASAP, is yes, you can usually feed your baby after they vomit all over your favorite sweater, sofa throw, and rug. Here's just about everything you need to know about feeding your baby after vomiting. Causes of baby vomit and spit up. Baby vomit and spit up are two different things, and they can have different causes. Spitting up is common in babies under the age of 1 year. It typically happens after feeding. Spit up is usually an easy flow of milk and saliva that dribbles from your baby's mouth. It often happens with a burp. Spit up is normal in healthy babies. It can happen for several reasons. About half of all babies 3 months and under have a type of acid reflux called infant reflux. Spit up from infant reflux is especially bound to happen if your baby has a full stomach. Being careful not to overfeed a bottle-fed infant can help. Spitting up typically stops by the time your baby is a year old. On the other hand, vomiting is typically a more forceful throwing up of milk, or food, if your baby is old enough to eat solids. It happens when the brain signals the muscles around the stomach to squeeze. Vomiting, like gagging, is a reflex action that can be triggered by a number of things. These include irritation from a viral or bacterial infection, like the stomach bug, fever pain, such as from a fever, earache, or vaccination, blockage in the stomach or intestines, chemicals in the blood, like medicine, allergens, including pollen, very uncommon in babies under 1 year, motion sickness, such as during a car ride, dizziness, which might happen after being twirled around too much, being upset or stressed, strong smells, milk intolerance. Vomiting is also common in healthy babies, but it might mean that your baby has caught a bug or is feeling a bit under the weather. When to feed your baby after they vomited. Too much vomiting can cause dehydration and even weight loss in very serious cases. Milk feeding can help prevent both of these. Offer your baby a feeding after they've stopped throwing up. If your baby is hungry and takes to the bottle or breast after vomiting, go right ahead and feed them. Liquid feeding after vomiting can sometimes even help settle your baby's nausea. Start with small amounts of milk and wait to see if they vomit again. Your baby might vomit the milk right back up, but it's better to try than not. If your little one is at least 6 months old and doesn't want to feed, after throwing up several times, offer them water in a bottle or a spoon. This can help prevent dehydration. Wait a short while and try feeding your baby again. When not to feed your baby after vomiting. In some cases, it's better not to feed a baby right after vomiting. If your baby is throwing up because of an earache or fever, they may benefit from medication first. Most pediatricians recommend pain medications like infant Tylenol for babies in their first year. Ask your doctor about the best medication and dosage for your baby. Giving pain medication based on your doctor's advice, wait about 30 to 60 minutes after doing so to feed your little one. Feeding them too soon might cause another bout of vomiting before the meds can work. Motion sickness isn't common in babies under the age of 2 years, but some babies may be more sensitive to it. If your baby vomits from motion sickness, it's better not to offer a feeding afterward. Urine muck. If your baby likes to nod off in the car, wait until you're out of the car to feed your baby milk. When to call your baby's pediatrician. Baby vomiting can be worrying, but it usually goes away by itself, even if your baby has the stomach bug. Most babies with gastroenteritis don't need medical treatment. This means that most of the time, you'll have to bravely wait out your baby's vomiting. But sometimes, throwing up is a sign that something's not right. You know your baby best. Trust your gut and call their doctor if you feel your little one is unwell. In addition, take your baby to a doctor immediately if they've been vomiting for 12 hours or longer. Babies and children can dehydrate quickly from too much vomiting. Also call your baby's pediatrician if your baby can't hold anything down and has signs and symptoms of being unwell. These include constant crying, pain or discomfort, refusal to feed or drink water, diaper that hasn't been wet for 6 hours or longer, diarrhea, dry lips and mouth, crying without tears, extra sleepiness, floppiness, vomiting blood or fluid with black flecks, coffee grounds, lack of smile or responsive vomiting, green fluid, bloated tummy, blood in bowel movements, minimizing vomiting associated with feedings you won't usually have any control over when or how much your baby vomits. When it happens on occasion, repeat this mantra to help you cope. Healthy babies sometimes vomit. However, if your baby often vomits or spits up after feeding, you may be able to take some preventative steps. Try these tips: avoid overfeeding, give your baby smaller, more frequent feeds, burp your baby often between feeds and after feeds, prop up your baby so they're upright for at least 30 minutes after feeding, but don't prop your baby up for sleep or use anything to position them in their crib or elevate their mattress. If your baby has a tummy bug and is old enough to eat solid foods, avoid feeding solids for about 24 hours. A liquid diet can help the stomach settle after a bout of vomiting. The takeaway: vomiting and spit up are common in healthy babies. In most cases, you can milk feed shortly after your baby vomits. This helps to prevent your baby from getting dehydrated. In some cases, it's best to wait a little while before trying to feed your baby again. If you're giving your child medication like pain and fever relievers, wait a bit so the meds don't come back up. If your baby is vomiting a lot or seems otherwise unwell, call your pediatrician immediately. If you're unsure if your baby's vomiting or spit up is cause for concern, it's always best to check with your doctor.